We've been following Edie Hill ever since she announced on our show that she was battling a family history of cancer by getting a prophylactic double mastectomy, which is having both breasts removed even though she hadn't been diagnosed with breast cancer. She had the surgery just 2 weeks ago, and Edie's back to share what happened on that life-changing day. Please welcome the very brave Edie Hill. Welcome, Edie Hill. Okay, so literally, we're at the 2 weeks and 2 day mark. How are you feeling?
I'm feeling really good. I'm off the painkillers during the day, but it was very interesting when I was on them. And now I just take them really at night. And what I wanted to do is I'm wearing a dress that I wore one of the times that I was co-hosting, because I thought that the amazing thing to me was that I don't think I look that different. You know, I'm a little flat on the left side, but the reconstruction is an ongoing process. But I think I felt that I would look like something completely different than I ended up
completely flat. You probably thought, right?
I did. Yeah. I thought it was my washboard.
Right. Well, they did. It was mastectomy, and then at the same time you had expanders put in, right? Is that what they're called?
They put the expanders in, and then over 3 months they gradually increased that to create a pocket where your breast used to be. And then they put a fake one in.
You were pretty calm when you were here talking to us 5 days before the surgery.
Would I fake you out?
Yeah. on the morning of, were those nerves kicking, or are you as calm as you were here?
When you look at the video, and my husband brought the flip cam in there, and he flip cammed everything. The tough thing was, I grabbed my breasts, and I just said, "Okay, there they are. That's what they feel like. Right. Goodbye." And then I was right at that point where I really wanted to cry, and you just make yourself nut, and you're gonna get through it, and I think that's my personality.
Yeah.
Well, you did, as you saw, go through it, and your husband Joe videoed everything, and we wanted to show how you felt immediately after waking up. We have a little bit of that.
I don't feel any different. I don't feel like I don't have anything there, but it sort of kind of hurts to, when you're breathing, it hurts a little bit to breathe. But honestly, it doesn't hurt as much as I was expecting it would. I don't have that emotional letdown yet that they said you might get. So, I don't know when I can take a look at myself, though. I think that'll be hard.
Well, there is the emotional and the physical. You talked about the physical, the fact that you are glad you did it because they found cysts that were could have been precancerous. But also there's the emotional. What happened? Tell us when they took the bandages off and you saw yourself.
When I first got the chance to sort of look down under the sheets, they still have these tubes attached to you, which are draining fluid, and it's kind of gross. It looks a little like a cyborg or something. And I was kind of freaked out by that, and you're fairly flat, but I still felt like me. And I think that part of that was because of the procedure that we had done was a nipple-sparing mastectomy, and I tried to retain as much of me as there was. But the key in my mind, and this came on Friday then when I got this information, after they biopsied all the tissue they took out, like many women in America, I had very dense breast tissue, which means you go in for a mammogram and they go, I can't really tell, go for a sonogram. And then they go for a sonogram and they had started to see this gray spot. And then I would go for an MRI. Well, we're going to keep an eye on that. Come back in 3 months. That, along with all the cysts that they found in the breast tissue, that gray spot was something that they call atypical lobular hyperplasia. And that's the thing that they said, that's what can turn into cancer. It was precancerous when they got it out, but I'm glad
so that
it's gone.
If you had any doubt, now you know you did the right thing.
Absolutely.
You want to talk about the emotional. Part of it is your emotional, and part of it is your husband and children. How did they react?
My husband's a smart man, and here's the reason I can tell you that. Because he's the guy that when you ask, do I look fat in these jeans? He says no. I mean, not even a beat goes by. So I said, as I went home right after Dr. Attkiss took the bandages off, I said, what does it look like? And he goes, well, you've seen yourself. And I said, I really haven't looked too much. What do you think it looks like? And he said, you look great. And
That's a
nice.
good
yeah, he may have
man.
been lying completely, but
what?
it was important that he said that because
is.
it made me feel good.
He's a good man. I want to mention another good man. Your plastic surgeon, Dr. Keith Attkiss, is with us. You mentioned him before. Two things. Edie mentioned retaining the nipple. Are there any dangers associated with that? Do you recommend that typically? And then what is her process from this point on in terms of any reconstruction, how many visits she'll have, et cetera?
Well, that's a great question, actually, because there is tissue right behind the nipple that is important to remove. So we're very thorough and very careful in removing that tissue. And in fact, we take a sample of the tissue during surgery and make sure it's clear before we commit to that.
Right.
But it's also important to mention that Edie doesn't have breast cancer. So for many women who do have breast cancer, it's much more common to remove the nipple and the areola at the same time and then reconstruct it later.
Okay. And then how many visits going forward will Edie have? What is she looking at now? Is it every 6 months? Is it 3 months from now?
Well, we actually got a good head start during surgery, so we got that temporary device, that expander that's in place, is probably half filled already from the first surgery, and that's why when she wakes up, she'll see a pretty reasonable shaped
Dr.
breast.
Whoopi is in love with you. Did you know that? You told me.
I feel the same way.
We're just saying how cute he was, that's all.
So once the expander's filled, it's getting back. Once the expander's actually reached that point.
I thought it was a nice compliment for the doctor.
Yes.
Okay.
And he's great with his hands.